Assalamu alaikum. So today we will discuss about the oculomotor nerve. So oculomotor nerve is the third cranial nerve and it is a pure motor nerve. What is the function of oculomotor nerve? It supplies the extraocular muscles. There are 6 extraocular muscles in eye, in which 4 are supplied by the third nerve. Which muscles are supplied by third nerve? Superior rectus, medial rectus, inferior rectus and inferior oblique. These are the 4 muscles which are innervated by the third nerve. There is a formula, very well famous formula, LR6SO4 thrice, right? So LR stands for lateral rectus, which is supplied by 6th nerve, which is abducent. SO4 superior oblique, which is innervated by the 4th nerve, and bracket outside the bracket you have 3. It means that rest of the muscles are innervated by the third nerve. So what are rest of that muscles? Superior rectus, medial rectus, inferior rectus and inferior oblique. And there is also one muscle which is the levator palpebrae superioris. It is also innervated by the third nerve and it is responsible for elevation or the opening of eyeball. So what is the pathway of third nerve? It starts from the nucleus of third nerve is present in the midbrain, right? So this is the rough diagram in which the upper part of the brainstem is midbrain, middle part is pons and lower part is medulla. So there are 2 nuclei of the oculomotor nerve which are present in the midbrain. One is the main motor oculomotor nucleus and other one is the parasympathetic nucleus, which is called Edinger-Westphal nucleus. So this oculomotor nerve emerges from the midbrain and then it comes outside the brainstem and then it passes through 2 arteries, right? What are these 2 arteries? This oculomotor nerve actually passes through 2 arteries. One is the upper one and the other one is the lower one. So the upper one artery is called the posterior cerebral artery and the lower artery is called the superior cerebellar artery. So actually the oculomotor nerve become a sandwich between these 2 arteries, right? It passes between these 2 arteries and then it comes toward the cavernous sinus, right? So this is the cavernous sinus. Cavernous sinus is a very important landmark because there are many different cranial nerve which passes through this. So the third cranial nerve passes from the lateral wall of cavernous sinus, right? You need to memorize it. So oculomotor nerve passes through the lateral wall of cavernous sinus and after passing through cavernous sinus it enters into the superior orbital fissure, right? And after entering into the superior orbital fissure it divides into the 2 divisions, superior division and the inferior division. Superior division supply which muscles? Levator palpebrae superioris, superior rectus muscle, right? While the inferior division innervates the medial rectus, inferior rectus and the inferior oblique muscle, right? So this is the very simple pathway of oculomotor nerve which you need to memorize. So it was all about the oculomotor nerve pathway. Now if we talk about the Edinger-Westphal nucleus, which was the parasympathetic nucleus of the oculomotor nerve, it also follows the same pathway, like it exits from the midbrain and enter between the 2 arteries, posterior cerebral and the superior cerebellar, passes through the cavernous sinus lateral wall and then enter into the superior orbital fissure. But what happened? It actually doesn't enter the superior orbital fissure. The Edinger-Westphal nucleus, after exiting from the cavernous sinus, it makes a ganglion which is called the ciliary ganglion, right? So Edinger-Westphal nucleus, after exiting from the lateral wall of cavernous sinus, it makes a ganglia which is called ciliary ganglia, and this ciliary ganglia innervate the sphincter pupillae muscles of the eye, sphincter pupillary muscles of eye, which are responsible for the constriction of the pupil, right? So now if we talk about the pathology of the oculomotor nerve, so oculomotor nerve lesion, if there is any lesion of the oculomotor nerve, then what will happen? There are 3 conditions will be happen. First one is called ptosis. Ptosis means drooping of the upper eyelid. Why this condition happen? Because there is a muscle which we talk, levator palpebrae superioris, which was innervated by the third nerve. So when that muscle will not get innervation from third nerve, then there will be the drooping of eyelid, and this condition is called ptosis. Second, you can get the lateral squint. This lateral squint will happen due to loss of innervation of the extraocular muscles which were superior rectus, medial rectus, inferior oblique. right, and inferior rectus. So due to loss of innervation of these extraocular muscle, patient will get the lateral squint. Patient will also get one condition which is called dilatation of pupil, or you can say mydriasis. Why this condition happen? Because we talked that there is the Edinger-Westphal nucleus which is responsible for innervating the ciliary muscles of the eye, and they cause the pupillary constriction. So when there will be the loss of innervation to the sphincter pupillae muscles, there will be the dilatation of the pupil and patient will have the condition called mydriasis. Now what are the causes of optic nerve damage? There are so many causes, like it can be due to head injury, it can be due to trauma, or it can be due to any tumor at the level of brainstem, right? Or it can be due to diabetes, right? So these are the common causes which you need to remember. I hope you understand. Thank you.